At the Medical Council, our responsibility is to protect patients. We ensure that doctors are competent, act professionally, and are accountable to their patients. We set the standards that doctors have to adhere to, and these standards are clearly outlined in the Guide to Professional Conduct and Ethics for Registered Medical Practitioners. In the guide, we provide guidance and information on the rights of patients and the responsibilities of doctors on a range of issues, including patient safety and confidentiality. You can download a copy of the guide from the website. Dr. Deirdre Madden, Chair of the Ethics Working Group, will now present you with a section-by-section overview of the guide.
Deirdre, the first section of the guide deals with the importance of trust in a relationship between a doctor and patient. What exactly would this mean?
It means that when patients go to their doctor, that they presume that they will be treated safely and effectively, that the doctor will treat them with respect and honestly and openly, will always act in their best interests and will keep their confidential information private.
And could you give us some examples of misconduct?
Well, the guide sets out standards of behaviour that the Medical Council expects doctors to adhere to. So where a doctor falls below those standards, then a complaint may be made to the Medical Council that the doctor has been engaging in misconduct. So, for example, if a doctor disclosed confidential information to somebody about a patient, that might be a situation where a doctor might be engaging in misconduct.
According to the guide, the responsibilities that doctors have to their patients is more important than the responsibilities they have to their employers or their colleagues. What does this mean?
It means that doctors must always put the best interests of their patient first and act in terms of the welfare of their patients. So if, for example, the doctor was aware of a potentially unsafe system in a hospital or a potentially unsafe conduct of a colleague, they must always act to put the patient's safety first.
And what kinds of responsibilities would a doctor have?
Well, the responsibilities that doctor has obviously varies, but it would be, for example, to make sure that he acts in the best interest of the patient all the time, that he keeps confidential information private, that he's open and honest with patients, for example, if an adverse event occurred, and just always to put the patient first.
What does the guide say about medical records and patient confidentiality?
It says that patients are entitled to have access to a copy of their own medical records, for example, and it also says that patients are entitled to expect that doctors will keep their confidential information private.
Are there any circumstances where a doctor would be entitled to disclose confidential information?
Well, there may be circumstances in which it's justifiable in the patient's best interests for a doctor to disclose information to others. So, for example, to share information about the patient with nurses or other doctors who are treating the patient, because that's clearly in the patient's best interests. And there may be other circumstances where, for example, they need to share information with a patient's carer so that the patient can be properly cared for on discharge from hospital. Usually that's done with the patient's consent.
Can a doctor treat without consent?
In some exceptional circumstances, it's justifiable to treat a patient without consent, such as in an emergency where a patient is brought to hospital following a road traffic accident, for example, and is unconscious. Then, of course, it's in the patient's best interest to be treated without their consent.
What sort of information should a doctor give before asking for consent?
The kind of information that patients usually want before making an informed choice about treatment would include the risks and benefits of treatment, any alternatives, for example, to surgery, perhaps the costs of the treatment, how long they might be expected to stay in hospital afterwards, any complications. The Council has set out in an appendix to the guide other kinds of information that might be useful for the patient to be aware of before making their decision.
So what should a patient do if they're not happy that they have received all the necessary information?
They can ask the doctor for more information, and the doctor is obliged to answer the patient's questions as fully as possible.
And what about the consent for the treatment of children?
Well, parents usually are asked to give consent in relation to their children up to the age in which they turn adults. But it is very important from a best practice point of view that as children grow and mature, that they are involved as fully as possible in their own treatment and that they give permission for any kind of treatment or care that they might receive.
This would be particularly important in the teenage years.
Well, particularly important in the teenage years, but even under the age of 10, children can have capacity to give an assent to treatment.
What does the guide mean when it says that doctors need to maintain their competence?
It means that throughout their professional lives that doctors are expected to keep their knowledge and skills up to date, to be aware of any new developments in, for example, surgical technique or any new medications that might benefit their patients.
If a doctor thinks one of their colleagues may have done something wrong, what should they do?
Well, the first thing that they must do is act in situations where they think that there may be a potential risk to patients, and take steps to make sure that patients are kept safe. So they may consult with a senior colleague, but ultimately it's a matter of reporting to an appropriate authority to protect patients.
Is a doctor allowed to advertise their practice?
Yes, a doctor is allowed to advertise their practice, but they must make sure that any information that they advertise is true and accurate and is not misleading to patients or raise any false expectations of cure.
If a patient wants to go for a second opinion, does their doctor need to agree?
The doctor should facilitate any second opinion or any referral sought by the patient, and should, for example, make copies of medical records available to whoever the second opinion is sought from.
And finally, what should a patient do if they feel their doctor may have acted inappropriately or made a mistake?
Well, if the patient has any concern about their doctor, they should contact the medical council.
To download a copy of the guide, please visit the Medical Council's website. Click the Media Centre button. Go to Publications. Click the 2008 to 2009 tab, and then to the Guide to Professional Conduct and Ethics for Medical Practitioners line, as I am doing. A file will then be automatically downloaded to your computer for you to view the complete guide.